The Sunflower Foundation had the opportunity to cross paths with Emily Brown, who is doing food as medicine in a very different way, but the heart of it is the same. And we're really, really honored to have her here today to share a little bit more about the story of Attane Health. And we promise if you start talking, we will get the slides up.
Thank you, Elizabeth, and thank you to the Sunflower Foundation and for the opportunity to speak with you today. I do feel like, I don't know how much more I can say. We just went to church. I just want to say thank you and amen for your service and all that you do for the community. And I think there's a lot of, when you hear my story, you'll hear some very, very similar themes. So I'm excited to give a little bit of background on myself personally, why I started Attane Health, and kind of our work and what we're doing today and where we're going. So Attane Health is a digital health platform that's patient-driven. We leverage technology to build personalized food and nutrition care programs. But at the heart of what we do, it's rooted in lived experience. So I'm not a physician, I'm not an RD, I'm just your regular community member who has experienced food insecurity. So in 2014, I was just a mom on WIC and SNAP, and at the time I was on Medicaid in the state of Kansas. I have two daughters who are in this picture. I love this picture. They're not this young anymore. They're 12 and almost 10, but I love this picture. They're so sweet. But both of my daughters have chronic conditions where food is the only management. And so, like many Americans during tough economic times, we were grateful for the support that we received from the WIC program, from SNAP, and being able to access care through Medicaid. But it wasn't enough. It was still very difficult for us to find and afford the foods that we needed to keep them healthy. So then I started a nonprofit, Food Equality Initiative, and Erin is here in the room who is taking on that legacy and keeping it going. But at Food Equality Initiative, I had an opportunity to work to bring special dietary foods into food pantries and to connect them to the patients who need it the most. And so I had an opportunity to become very engaged in our local community, serving as a patient advocate at Children's Mercy. I'm on the Family Advisory Board there, got really involved in really understanding and studying food-related conditions and food insecurity, and became quite obsessed with how do we get the right food to the right people at the right time. And so we had built this network of food pantries, but it was always very apparent that it was very difficult for people to overcome that barrier of transportation. And at the same time, we were seeing the rise of value-based care. We're seeing the rise of social determinants of health. And we started seeing this movement in digital health and how technology can scale access. And we all saw it over the pandemic with the intervention of telemedicine and how that just brought access where we had not had access before. And so we pivoted, we built a platform, and eventually pulled it into a separate entity so that we could scale it and really reach what we believe is the long-term sustainable path here, which is full integration into the healthcare delivery system. So I won't stay on this slide long. I feel like we've talked about this all morning, but we all know that the problem that we're solving is this challenge with access to healthy food that is driving up healthcare costs. So 1 in 3 Americans have a chronic condition that is food-related. So whether that's type 2 diabetes, heart disease, or food allergies, GI conditions. And we've seen the annual healthcare cost just increase significantly over time. And we know those impacted by food insecurity are spending more. And so what do we do about it? Attane Health is a mission-focused social impact entity that is focused on ensuring that everybody has access to the food that they need and the support and the education to really drive those outcomes. And we spent a lot of time talking about this afternoon. We've all heard from the policy experts, so I won't go deep into this because it's all been said before. But there are lots of market dynamics and policy dynamics that are really making this opportunity come to bear and really an opportunity to bring access. So we've talked a little bit about value-based care and how we're working to align payment models with what actually drives outcomes, and we know that's what takes place in the community and in the environment. We also know that preventative health care is important. So plans are increasing their investments in prevention. We just heard about an intervention that Healthy Blue is a part of, so we know that plans are at the table. And maternal health coverage, expanding that postpartum coverage up to 12 months. I believe I just checked the tracker and it's like 43 states have implemented coverage to 12 months. And so this is a wonderful opportunity not only to impact the health of moms, but to impact the health of our children who are the future. And then finally, all of the work around health-related social needs. And we've heard wonderful deep dives already into that administrative and legislative changes there, so I won't go into that. So at Attane Health, we've created a digital platform that really brings all of the pieces of the puzzle together. So it's personalized food selection, the ability for individuals to come on and select the foods that they need and want that meet their dietary guidelines, but also their cultural and taste preferences. And then we wrap that around with health coaching, one-on-one, to further drive those goals. And they're trained in motivational interviewing, so really working one-on-one. We deliver that care in both English and in Spanish. And we have a bench of diverse coaches because we know how important it is for that care to be delivered by a team that really understands the social aspect and cultural aspects of our foodways, as well as nutrition education, that we bring nudges to kind of reinforce that education through recipes and through text and nudges on the platform. And then finally, we know how important data is, and we heard earlier today how important kind of integrating that data so we can drive not only outcomes, but really determine that return on investment for total cost of care. So being able to provide back data not only on utilization, but that consumer shopping behavior and that rich data, qualitative data that comes through with our coaching. So we support programs in a number of different chronic conditions. We are primarily focused on these 5 today: maternal health, diabetes, hypertension, food allergies and GI, and hyperlipidemia. And we heard a little bit about Heartland Health this morning, so I thought it would be appropriate to talk about them since they're in Kansas. And so we had a target of about 25 patients in enrollment of this program, all focused on type 2 diabetes. The intervention term is 6 months. And so they receive a credit of $145 to shop on the platform. And so the way it works is we receive a referral from the Heartland Health team, Karen, who leads that work and works directly with the patients. They get enrolled on the platform, and they can just start shopping right away. They complete a short onboarding questionnaire, and that credit sits right in their account. And it's just, as they add items to the cart, it's a declining balance. And then we deliver those foods direct to their door. And they're able to select foods across grocery categories, including fresh produce. And we've curated it. So, I always like to say there are no Frosted Flakes, there are no Cheetos, all nutrient-dense foods, but we've curated it so that it takes into account both that cultural preferences, so they can select items based on allergens, certifications, ingredients that are important to all consumers, like organic, non-GMO, as well as diets and lifestyles. So diabetes, hypertension. So when they click that filter, they only see those foods that are safe or healthy for their diet. And we've talked a little bit about technology. And so it is not an app, it's a web-based platform, and that's intentional based on the populations that we serve. I will say with Heartland Health, we're talking about what's working and what's not working. We have served an older population. We talked about that data from the EAT evaluation earlier today. And so we are working very closely with the Heartland Health team. Our customer support team is able to be dispatched on site to provide additional training to support those members as they're enrolling in those programs. But we are excited. The engagement is high. We've got 40 orders. We just had one more placed since I posted this, created these slides. But what's fascinating is when you look at the order data, 60% of the users are purchasing across 5 categories on the platform. And fresh produce remains the top ordered item on our platform. But they're ordering things like seasonings to help them prepare their foods and make them tasteful. They're ordering pantry staples. We've heard that from Elizabeth earlier today. And so here's just a quick snapshot of some of our outcomes. 90% of our users on the platform are shopping month over month, with 30% of purchasing above their monthly subsidy. So we do have that ability to split tender. So that credit is provided by that healthcare organization, but then if they purchase above that, they can put in their debit and credit card to purchase above. We do not accept SNAP and EBT today. It's actually a policy issue. Online SNAP is available in all 50 states, but it is a challenge with USDA. The vetting process essentially was made for brick and mortars. So we're an online-only retailer. We don't have a brick and mortar store. So that is a policy issue we're working through right now with USDA through Farm Bill, working to try and pull together a pilot to really create those vetting processes for legitimate businesses for online access. And it's not just an issue for Attane Health, it's an issue for online farmers markets. We talked about how can we get greater access for farmers to go direct to consumers. It's a barrier. But we're also seeing improvements in nutritional literacy. So we did complete a study, a clinical study with Stanford with Food Equality Initiative in allergic disease, and we did improve nutritional literacy, so the ability to read the label and self-manage on understanding allergens. We increased that on those who participated in that clinical trial. And again, we are nationwide because of technology. We manage our own supply chain networks, both large and small, so we're able to be nimble. And so we've delivered to date to 29 states, but we are able to service every zip code. And we continue to look for partners, supply chain partners, so we can continue to make that a very robust experience. And so again, we're not delivering produce here from Kansas or Missouri to California. We build those relationships directly. And so we are very proud. We recently went through the Medicaid Innovation Collaborative showcase. This is a showcase for individuals who are looking to improve and bring innovation to the Medicaid space. And so we were ranked #1 by the Medicaid Consumer Panel, the #1 food and nutrition platform. So we're really proud of that because it just is a validation of our approach, which is really focused on empowering individuals that come onto our platform and supporting them to make healthier choices over time, because we know small changes add up. And we serve on a number of national task force that we're involved in just to continue to build and expand access through those federal payment models. And then I told you about our advocacy efforts on online SNAP access, so that's really important to us. But we're excited to continue to convene with you and work together to continue to build access. So I will be here today and through Friday, so please reach out. We'd love to connect and work with you to continue to bring high quality access to nutrition care, particularly in areas where it's really difficult to serve.
Okay, applause, and then I have a question. That was awesome. Technically, we're not supposed to ask questions after APATEDs, but I'm breaking my own rule. because you said something that you said it's a web-based platform rather than an app because of your audience. Can you speak more about that?
Yes. We all know that technology is very useful and very helpful in scaling, but we know that there is a technological divide. And so we didn't build an app, it was purposeful. We built a web-based platform that, and it just eliminates the additional barriers of having to download an app, maintain an app, because you also often have to re-download them several times, so it's like a bandwidth issue. So although we're a web-based platform, we are mobile first. So a large percentage of our users are accessing us on a phone, but it's not an app. So they don't have to download something, they don't have to use the extra bandwidth, and they don't have to continue to do that, because if the app updates and they don't update it, I mean it's just a lot of a lot of problems. And I will say one other thing that I'm not sure I made very clear is, as we're having this conversation in the context of rural communities, one of the things that we've done at Attane Health is we've made a very intentional decision to build that supply chain network versus just connecting with the existing retail infrastructure. We've talked today about how that infrastructure can be lacking in rural communities, and it's also lacking in urban communities where there's been essentially disinvestment. So we believe that having that supply chain network that's robust allows us to increase access to high quality foods that individuals can't find in their community, but we're able to deliver direct to door, which then allows them to have that access where maybe there's a grocery store, but they still can't get there because they don't have transportation. So we're solving for those problems that are really difficult. And when we think about how do we build the infrastructure to support individuals long-term.
That's fantastic. And thank you for the web-based app thing. That makes total sense now that you explain it. It's amazing the dirty details that go into anything around the Rubik's Cube of food as medicine. One more question, remind me, you wrote a paper for the Milken Institute, or they featured you on a video?
Yeah, we wrote a paper.
Yes.
That was featured in their, I think it's called Milken Ideas. It was like ahead of their summit. So I wrote the paper and then I participated on a panel at the summit.
We'll make sure to include that in the follow-up. It was an excellent paper, really. So if you all will, once again, thank Emily for me. Thank you so much. Okay.